Bob and Brad, the two most famous physical therapists on the internet.
Hello, folks. I'm Brad Heineck, physical therapist.
And I'm Shari Berry, physical therapist.
And I'm exactly one half of the Bob and Brad team. However, Bob is not here today, but we're very fortunate enough to have someone much better looking than Bob. So this is a whole new experience, and I don't have to listen to Bob as well. So I'm very happy. So we're extremely happy to have Shari Berry, and she's an specialist.
Yes.
I think she's an expert. But anyways, we're going to talk about the vertigo, dizziness, and this is the person you want to hear and get proper information for. So Shari, do you want to do a little introduction about
Sure.
your background?
Yeah. I have been a physical therapist since 1994 with a bachelor degree. Then went back for my doctorate in 2007. But in 2004, I became an official dizzy therapist. I've always been a little dizzy, but I became an official dizzy therapist
Okay.
in 2004. And so really since that time, I've been treating vestibular problems or problems with dizziness.
Sure.
In 2004, it wasn't very popular. Now it's much more popular. And so
You mean popular that more people have it, or that it's more
people
the
have had
treatment?
it. It's just now we're understanding what people have, and
Okay.
we are better at identifying it and treating it. So
Yes,
we've
excellent.
made great gains that way.
And she's being very modest because she actually teaches classes to therapists like me. I took a vestibular class from
Yes.
you a couple, 3 years ago. I don't know, maybe it's longer than that. Time
Might be
flies.
longer.
But anyways, we'll get on with the program, and we're going to talk about this wonderful ear and this model. And it reminds me of that guy on Star Trek that's got the big ears.
Yes.
All right, Shari, here we are. We've got the vestibular system, vertigo, dizziness, all these things. And we're going to talk about actual treatment
Yes.
and what you can expect if you go in, and some things maybe you can do. And Shari, you're still directly treating patients. And we're going to have a volunteer. Mike's going to come in. This is exciting. This is going to be very helpful for everyone. And I'm just going to kind of stand off and watch. Maybe I'll ask a question here.
Absolutely. You're
Okay.
welcome to.
Carry on.
I am still treating, not as much as I'd like to.
Sure.
I teach full time. And so when I've trained a lot of people to do what I do in the clinic, but sometimes the schedule's full and they'll call me and say, "Can you see someone?" And I
Yeah.
say, "Absolutely." So
And she's got children in hockey, so
yes.
you know what that means.
means I'm going all over the world. So exactly. So yeah, I think we talked a little bit in our last segment about some anatomy. I just want to highlight a couple things before we get into what can you expect when you go in.
Okay.
So just a reminder that your vestibular system is very complex.
So it's
And
in the ears.
well, part of it is in your ears.
Yep.
And then part of it is your eyes and part of it is your body. So your
Okay.
eyes, your ears, and your body are telling your brain where you are at all times.
Okay.
And then your brain is making an appropriate response to that. And when things go poorly, if there's a conflict, if your eyes are saying one thing and your ears and your body are saying a different thing, your brain's response is to hit the puke button and you feel sick.
So abnormal information's
Yes.
going in there, and then we throw up.
Exactly.
Hmm.
Or you might, if you're lucky, just feel dizzy.
Okay.
And so that's typically what brings people to the point where they think, something's wrong with me. I should go get checked out.
Yes.
And so what we want to talk about is what are the things you might be able to do at home?
Mhm.
And then what can you expect if you were to go in and see a physical therapist or see a provider who might take a look at you?
Sure.
So I think it's also important for us to talk about just a little bit about how those inner ears are working.
So if someone's getting these symptoms
Yeah.
and they throw up, they darn well better go in to see someone.
Correct. I think dizziness and being sick can have other causes other than the vestibular problem, and you want to make sure you rule those out.
Okay.
You can have a stroke, you can have a heart attack, you can have some big bad stuff.
Sure. Yep.
And you want to make sure you don't have any big bad ugly stuff going on
Right.
before you start working on this.
Okay.
Okay.
Because once again, these are not real, though.
You feel bad, but they're probably not going to kill you.
Yeah. No, but I mean, yeah, and it can be treatable without
Yes.
a lot of special stuff. but
Correct.
Just knowing what we're going to talk
Right.
about.
So I think in the case like you just said, if you have a unilateral hypofunction or one ear goes on vacation, you feel terribly sick. You are
Okay.
very, very dizzy. You are very, very ill. You probably feel like you're having a stroke or a heart attack, and you end up going to the doctor or the ER.
And this is a constant feeling. You
A
don't.
constant feeling of dizziness. You might
Okay.
wake up with it and it is there. And it is there all the time as you're sitting still,
For
you're
like
dizzy
all day long.
all day long.
Okay.
And it can last a few days, actually.
Okay.
Usually the first day is the worst. Then your brain tries to start figuring it out. And by day 3, you're feeling a little bit better. If you don't go in,
Yep.
some people think they just have a bad case of the flu.
Sure.
They don't go in.
Yep.
Usually 4 to 6 weeks later, they're feeling pretty normal again. But it takes a while for your brain to figure it out.
Right.
So there's things you can do to make your brain adjust faster.
Okay.
And so I think that's one of the things that I'd really like to highlight today
Sure.
is what's one of the exercises. If one of your ears took a vacation and you had a loss of one of the vestibular apparatus or the input from one side,
Mhm.
you're going to feel horrible. And then what can you do to feel better faster?
Sure.
So as I mentioned, do you remember I told you that this system, you can have an intentional motor response or you can have a reflexive motor response, an
Sure.
automatic response that you don't have to worry about.
Right.
One of the automatic responses is your eye movement, and it's called a vestibular ocular reflex.
Ooh.
So
Don't want to have one of
it
those.
sounds complicated, but it's not so bad.
Okay.
So here's how to explain it.
Okay.
If you look at your palm, find a place on your palm where you have lines, creases that cross.
Okay.
Okay. If you move your palm to the left and to the right and you just track it with your eyeballs without moving your head,
Mhm.
go as fast as you can, but don't let that section blur or jump. You can only go so fast. It gets blurry,
Sure.
right? Now, find that same spot.
Yep.
Instead of moving your hand, you're going to move your head to the left and right. Just a quick little rotation, fast as you can, keeping that spot in focus, and you'll see that you can move your head a whole lot faster.
Right.
The reason you can do that is the vestibular ocular reflex. As your head moves one way, your eyeballs can stay pinned on that another way.
And that's normal.
That's normal.
Right.
You are normal.
Good.
We
Not
have
many-
that on video.
Not many people say that.
When you have a vestibular problem where one ear takes a vacation,
Yes.
that becomes a problem. And
So you can do this, but if you do
both will make you yucky.
Oh,
Both will
will
make you yucky.
You mean like
bleh,
okay.
Feel a little pukey.
Throw up kind
Yep.
of a thing.
And very dizzy.
Mm-hmm.
So your brain has to remap the messages it's getting. And it does that when you move your head. So Mike, if I can call you in as a sample here, I'm going to have you sit on the table and we're going to give you a business card. So if I have a person who has a unilateral loss or you experience this or you have been diagnosed with it, you're going to hold a business card at arm's length away. Find a letter and keep it in focus. You don't want it to jump. You don't want it to skip. You don't want it to blur. And you're going to turn your head to the right and to the left, starting very slowly. If Mike were acutely involved or just had this happen to him, he would probably be moving this slow because this would be enough movement to make him feel a little yucky.
Okay.
You're going to do that for 2 minutes, 3 or 4 times a day.
You should time it so it's
Time
don't
it.
just guess.
Try to get for 2 minutes.
Yep.
You may not make it 2 minutes. You might only make it a minute when you're first involved in all of this.
What happens then? You just start feeling so.
You start feeling really terrible.
Yep.
So let's say you make it 2 minutes, you stop, and you think to yourself, I feel a little yucky. The yucky should go away in 15 to 20 minutes.
Okay.
If it lasts longer, you've gone too fast. You have to slow down the next time you do it. So within probably 2 weeks, Mike will be doing this activity, looking at that letter, and being able to shake his head pretty rapidly. The brain adapts that quickly. And so then he can do that for 2, or maybe Mike should practice. That looked like that bothered you for just a little bit. So you want to do that for about 2 minutes, 3 or 4 times a day. It retrains your brain to accept the messages from your ears and make sense of it.
So it's
And you can get better faster. Very
And that's
simple.
with BVVP or that's
No, this is with a unilateral hypofunction.
That's where it's
One ear
always
takes out.
okay. You have that constant
yucky.
Okay.
Yep.
All right.
Positional vertigo is a little bit different.
Okay.
Now, we talked about positional vertigo, and we talked about the fact that deep in your inner ear, you have semicircular canals that are fluid filled. Mike, if you rotate your head to the right, there's fluid that moves to the left. If you rotate your head to the left, there's fluid that moves the other way. In a fluid-filled system, the fluid's moving. It gives information to your brain about where your head is in space. Okay? You have also a part in the middle ear where these canals are attached that give you information about linear acceleration if you're moving forward or backward, or if you're moving up and down like in an elevator.
Kind of
Okay?
movement in space,
Yep.
kind of.
In that section of your ear, you have little crystals that are attached to hair cells, and they are called calcium carbonate crystals. We like to say you have rocks in your head. You really have rocks in your ears. Okay. So one of those little rocks pops off that area, drops into the fluid filled canal, and it's like dropping a pebble into a pond. It creates a ripple. So, Mike, if you turn your head to the right, the fluid moves, and then the crystal drops down through that canal, creates a ripple in the fluid because the crystal is affected by gravity,
Sure.
and it drops to the bottom. And while that's happening, Mike has a sensation of being dizzy.
Is this actually spinning dizzy?
More often than not, people will tell you, I feel like I'm spinning or the room is spinning.
Okay.
And that is very classic symptoms of positional vertigo.
Okay.
The other classic element of positional vertigo is it only lasts seconds to minutes.
Okay.
Okay. So Mike says, I keep getting this spinning thing every time I roll over in bed. I should maybe get this checked.
Yep.
Okay. So what can Mike expect when he walks through the door of physical therapy? The most common test for this is called a Hallpike-Dix test. So, Mike, I'm going to take you through that test here in a minute.
Oh.
If you will turn so your feet are on the mat out in front of you and you're in a long sitting position, perfect. Then I'm going to turn your head to the right, and then we're going to tip you down so your head just falls off of the mat here into that position, and that's a Hallpike-Dix test. Typically, I would have special goggles on his face, which would magnify his eyeball. His eyes, if he had positional vertigo, would do this funky twisting thing.
So you're watching through.
And I'm watching the video if I have video goggles.
Yep.
Or if I don't, I'm watching his eyes like this, because I'll even be able to see that eye movement without goggles. It's a little harder to see, but you can.
Will the patient know that their eyes are twitching?
No.
But
they'll
can see
feel
it.
dizzy.
Yeah, okay.
They'll feel like they're spinning.
Okay.
And when you have goggles on, you can start to see their eye move, and you'll say to the patient, all right, it's starting. And then you'll see their eyes stop moving. You'll say, okay, you should be feeling better. And the patient will say, how'd you know that? Because we could see it in your eyeballs. Okay. Then when Mike sits back up, keeping your head to the right, it'll all happen again because we're moving that fluid, the little crystal drops, and we create that again.
Now, sometimes does a therapist do that a little more quickly?
We would typically do it quickly. If a person's not too sick or not too sensitive in the stomach, we can move it quickly. We want to move that fluid quickly, bring them up quickly. It's easier for us to see what's happening that way.
Sure.
All right. So, Mike, you can sit back to the front there again. A physician or a doctor might even do that test in the clinic also. It's the test that we use to predict positional vertigo. Okay.
Because if it's positional, then there's another treatment.
There is treatment for positional vertigo, and it's pretty easy to do. We just have to roll you around a little bit and put the crystal back where it belongs. Okay. The treatment depends on which canal is involved. But here's the good news. 85 to 95% of the time, it's the posterior canal. And so I'm going to show you an exercise you can try at home that actually addresses the posterior canal, and 85 to 95% of the time, it works.
So when she says posterior canal, it's in the vestibular system. You don't have to really understand that.
No, you really don't.
As a therapist, or if you really technically do, but so we're going to show the treatment.
You got 3 canals in this ear, 3 canals in this ear. 85% of the time, it's in one of those 3 canals, and the position to fix it is what I'm about to show you.
And this is a maneuver that, what's it called?
It's the Brandt-Daroff maneuver. It's how we used to treat everyone with this before we had goggles.
What about the Epley? Isn't that kind of high in the...
The Epley...
Because we do have a video on Epley, and that's what I've used.
Oh, yes. So the Epley, as a therapist, if you've identified which canal is involved, the Epley targets that canal.
Sure.
And then you're specifically moving the fluid in that canal quickly to send that crystal home. The Brandt-Daroff is similar to that. We're just targeting the posterior canal.
Okay.
Playing the odds. 85 to 95% of the time, that's the one that's involved. Pretty good.
Yeah.
So if it's not, you've tried it at home, then you can go see a specialist, pay the extra money, whatever you need to do. But if you're not too sick, this is a great thing to try at home.
Oh,
Okay.
so you got symptoms where you turn your head, you roll over, but it's
You can
not
try
too bad.
this.
Go ahead.
Yep.
So listen carefully.
Yes.
Because I think there's some little things in here.
There are some really important things to
Yep.
doing this correctly. So, Mike, first, when you are at home, you're going to want to sit somewhere where your feet are in contact with the floor. This is a little high, so we're breaking the rules already.
Sure.
So you're going to sit where your feet in contact on the floor, either on the side of your bed or the side of a couch.
Okay.
Works great. So what you're going to first do is you're going to turn your head to the left, and then very quickly you're going to lay down on the right shoulder. Now, the key to this is you don't want to turn and look where you're going. You want to go as quick as you can, but you want to keep your head to the left as you throw your body to the right. So as quickly as you can, you're going to go down to the right.
Whoa.
Yes, just like that. That was perfect.
And keep looking up.
And you keep looking up. Your nose is to the ceiling. Here's the other piece where things go poorly. You don't want to roll back into the couch. You want to stay directly on your side, your nose to the ceiling. You flip yourself down and you wait for the dizziness to come. You wait for the dizziness to go away. And you count to 20.
After it goes away.
After it goes away.
And typically, if this is the right thing, it'll go away within 30 seconds or so?
30 seconds to a minute at most.
Okay.
Exactly. Once the dizziness is gone and you've counted to 20, then you sit right back up to the middle. And you're probably going to get dizzy again. And so you wait. When the dizzy is gone, you count to 20.
Yep.
Then you turn your head to the right. And you're going to flip yourself down to your left shoulder. Again, don't look where you're going. Trust where you are. Flip yourself to the left, fast as you can. Don't roll back. Nose stays to the ceiling. You wait for dizziness to go away and count to 20.
Just 1, 2, 3, or 1, 2, 3, 4, 5, 6.
1, 2, 3.
Like 20
You
seconds.
can do Mississippi's if you'd
There
like.
you go.
Okay. Then you can come back up again, Mike. And this is considered one repetition.
Okay.
You have to go down and up to equal 1.
So that could take 3 minutes or
Yep.
so.
You're going to do 5 of them.
Right in a row.
In a row.
Okay.
By the 5th one, so with positional vertigo, your brain gets used to the input that it's getting, and you get less and less dizzy. Very common that by the 5th one, you're not really that dizzy anymore. So if you lay down and you don't have dizziness, you just count to 20.
Oh.
And then you sit back up.
Oh, nice.
You lay down the other way and count to 20. If you can do this 2 to 3 times a day, more often than not, you can either self-correct by sending that crystal home, or there's a theory of the Kool-Aid method that you're shaking it up enough to kind of dissolve that crystal.
Oh.
That maybe isn't as sound as sending that crystal home.
One way or another. So, and this is something like typically in your experience, they'll by the 5th one.
Feeling better.
Feeling better.
Yep.
Okay.
Yep. And again, 2 to 3 times a day is great.
Yep.
Most people, after a week or so, don't need to do it anymore. They're feeling better.
Yep.
So this is a real easy home treatment to try.
Sure.
Now, where things go wrong is when people go down and they're really, really dizzy and they just can't handle it. Go and see someone. They can fix it a little faster.
Yeah.
So if this is too much at home, there are other things that we as physical therapists can do for you very easily in the clinic.
Yeah, like if you go down and you just feel like you're gonna throw up, or you do.
Yeah, or you do.
Yeah, get some help.
That'd be a good indication to go get someone to give you a hand.
All right. Well, that's excellent.
Yeah.
This, at home, you can do it yourself. Pay attention. I always tell people when they comment and look at the video again. The details are in there. So you did an excellent job of teaching this.
Excellent job of being my patient.
Yeah.
So,
well,
good deal.
Actually, people don't know this, but Mike was Shari's student.
Years ago.
10 years ago or so?
Yes.
Yeah. So, yeah, there's a lot of history going on.
That's
here.
right.
And Mike's doing behind our scenes, doing all kinds of stuff with the computers and filming.
Making the magic happen.
And he's, what are you doing? Are you doing some filming? You're putting some little short things out. Yeah, the motivational ones.
Nice.
But yeah, that's right. You're not doing the other media that we do. I'm thinking what Matt does. What Matt does? What does he do? Instagram. You don't do any of that. I don't know what the hell's going on. Anyways, we got to go. Have a Merry Christmas.
Thanks.